Subhanallah. Dear friends and colleagues, today we have a very special guest with us. As the whole world is caught off guard because of coronavirus pandemic, would like to explore more from the source or the practitioner who are working day, day to day, every day and dealing with this coronavirus. So would like to introduce the guest and let's go to the guest. This is Dr. Saqib Hasan. He is an infectious disease specialist with John Peter Smith Hospital in Fort Worth, Texas. Welcome, sir. Dr. Hassan, would you please give us a little bit of your background to the audience?
Thank you very much. Thanks for having me. So I've been practicing infectious disease for almost 25 years. Um, and currently I'm working at JPS Hospital in Fort Worth and have been seeing a lot of patients with uh, uh, coronavirus.
Thank you very much. So it is our honor to have you in our program, and we would like to ask you some basic questions that will give our audience in general population a little bit more knowledge about this pandemic. First of all, we would like to understand the word pandemic. So Dr. Hassan, would you please explain to us in a simple way, what is a pandemic?
So pandemic is, to understand pandemic, we have to take a step back and explain what an epidemic is, which I think is a term people are more familiar with. So epidemic is when you have an outbreak which affects a large geographic area. An example of that is, if you can remember, I think it was 2014 when we had a Zika virus epidemic, which started in Brazil and spread to most of Latin America and Caribbean. Similarly, most people are familiar with the Ebola virus epidemic, which affected several countries in the West Africa, which again started in 2014, lasted till 2016, and affected a large geographic area, mainly Sierra Leone, Liberia, and Guinea. And currently, there's an epidemic going on in the Democratic Republic of Congo of Ebola. So those are epidemics. So those are affecting a large geographic area. But once an epidemic spreads globally, affecting large part of the world, then it is called pandemic. And I'm basically referring to infectious diseases at this time. So an example of a pandemic that people talk about is 1918, which was almost a century ago, of the Spanish influenza, which affected almost a third of the world population. So that was a pandemic, a very large pandemic, which killed almost 50 million people at that time. And similarly, there have been pandemics afterwards of influenza in 1957 and 68. There were influenza pandemics affected large parts of the world. The one that is during our lifetimes was in 2009. You can recall H1N1 pandemic. It was not as deadly, but it affected large parts of the world. And there were two, usually influenza is one season. 2019, there were two seasons. It started in spring as well as in the fall, the typical season that happens.
Great, great. That's a very knowledgeable information from you, and our audience would really appreciate. So, beside the pandemics you have mentioned to us, have there been other pandemics in the recent centuries?
So, in the recent, like I mentioned, about a century ago was the Spanish influenza, which was in 1918. And affected a large part of the world. Almost a third of the world population was affected by that pandemic. And the other pandemic, which started as an epidemic, is the HIV in the 80s started in, again, West Africa. It was an epidemic at that time, and then it became a pandemic, and it spread slowly. It's not a respiratory virus, so it spread slowly, but it has spread throughout the world. Uh, and of course, there are areas of the world which have more of HIV infection. But at this time, from being an epidemic in West Africa, becoming a pandemic, it has now become what we call endemic, meaning you expect certain number of cases in parts of the world. So in this country, about 1 million people have HIV infection that we know of. I mean, there are probably more infections than that are not diagnosed, but about, give and take, about 1 million people have that infection, and that now considered an endemic infection, meaning you have similar numbers in some risk groups which are present at this time. And they are seen in Africa, of course, parts of Asia and Europe, of course.
Oh, great. That's very valuable information for us to know that. Okay, that leads to us next question. What are coronaviruses?
So coronaviruses as a family is a large family of viruses. So it affects many mammals and birds. And usually in those animals and birds, it causes respiratory illness and also gastrointestinal infection. The viruses, coronaviruses that are that cause disease in the humans are 7. 4 of them are very common and cause respiratory illness during winter and spring months, and usually like a common cold. About 15% of the common cold are caused by 4 coronaviruses, and those are mild illnesses. So most of the time, many people have been infected. It happens all the time, especially during the winter and spring months. Then you have 3 other coronaviruses. So like I said, 7 of them altogether. One of them first emerged in 2003 from Southeast Asia and spread to many parts of the world, but it hasn't been seen since 2004. In the US back at that time, there were about 8 cases, but those were imported cases. Those did not spread through the population, and we haven't seen any of that since that time. The other coronavirus, which is called MERS-CoV, is called Middle Eastern Respiratory Syndrome. That was seen in 2012 for the first time, and it started in the Arabian Peninsula, Saudi Arabia, UAE, Qatar, Kuwait, and some other Arabian Peninsula countries, and it spread to Southeast Asia and other parts of the world. But most of those infections are sporadic and are still seen in Arabian Peninsula, and some of them are imported to other countries when people travel. The one that we are seeing at this time, which started in 2019, and it's causing what we call COVID. That's the disease's name is COVID-19. It's the SARS virus. It's another SARS-CoV-2, which is another coronavirus, and is the cause of the infection that is affecting the whole world at this time, and has caused almost 2 million infections in the US itself, and over 109,000 deaths in the US itself.
Great. Thank you very much. So you have given us the definition of coronaviruses and the different types of coronaviruses. That leads to us next question. What are the signs and symptoms of coronavirus infection?
So when a person is sick with this virus, they will have, most of the people, not all of them, will have fever. They may have a cough. Most of the time it's a cough without any sputum production. Some of them will have shortness of breath, which is a common symptom with this infection. They may also have body aches, and some of the unique symptoms and signs are loss of taste and smell. Some people may have headaches also, or sore throat, or nausea, vomiting, diarrhea may also be seen sometimes. So those are the common signs and symptoms. Now, keep in mind, almost 80% of the people have very mild symptoms, like a common cold, or may not have any symptoms at all. And some people may just have a fever, some may have cough. So so that's the nature of this infection. Is many people are asymptomatic or mildly symptomatic. They may not realize they have the infection, and they may be spreading the virus to others, especially in their family.
Yeah, that's very dangerous, not knowing that someone
Yes,
is
yes.
infected and they are spreading the virus. So that's very dangerous. Thank you very much for that. And that leads to us next question: which body organs or systems are affected by this disease?
So the primary infection is in the upper respiratory tract or the lower respiratory tract, maybe meaning causing the upper airway to be infected, but also when it goes down to the lower airway, meaning the lungs primarily. Those are the two main organs that are that's the main organ system that is affected, is the respiratory system. But then it can cause damage to some other parts of the body, like the heart. We're seeing it can cause encephalopathy, meaning affect parts of the brain. Sometimes can cause strokes, can cause coagulation disorder, meaning clotting problems with clots in the veins and also in the arteries sometimes. So it can affect many other parts of the body besides the lung, which is the primary organ affected by it.
Thank you. And I believe that's why those individuals who have underlying conditions with different types of other, diseases, this coronavirus disease affect them significantly than the others who are a little bit more healthier. Is that right?
Yeah, so there are some risk groups for this infection. So people with underlying medical conditions. One of them actually is what we call obesity. So if you have a certain body mass index, you're above certain body mass index, you are at higher risk of getting severe illness. People with underlying heart conditions, diabetes, hypertension, chronic lung conditions, or people who have cancer, or people who are older. So we are seeing that people who are of older age, and they tend to have more comorbidities, other medical conditions. They are at higher risk of infection. Again, certain races we are seeing are getting affected by it disproportionately than others. So African Americans, Latinos, and Hispanics, as well as certain Indian tribes, especially Navajo Indians, they are getting disproportionately affected, and part of it is because of the other medical comorbidities.
Thank you. What about the age group? Do children or teenager or middle ager they have more risk than the older age population?
So children are also getting affected. We don't have as much information, and I'm not a pediatrician, so I may not be able to talk specifically about that. But yeah, there are some illnesses that are being described in kids also. Initially, they were saying that kids are generally not getting affected as uh, uh, much as adults are, but there are some syndromes that are being described in young children also. Um, so I guess we don't know the scope of it at this time. For the most part, it is affecting mostly adults and older adults.
Thank you. That's very important information. One thing that I have noticed, the data and statistics that we are talking about predominantly, mostly from North America, United States. However, do you have any information coming from data from Europe? Like, there are some homogeneous Caucasian population like Spain or like UK or France or Germany. Their majority of the populations are Caucasians. So does the ratio same over there compared to here in the United States?
So, like from following some of this information, yeah, in UK, more Asians disproportionately are getting affected, and that is again partly because of the higher incidence of diabetes in Asians at a younger age in UK population. than the local Caucasian population. So that is because of the underlying comorbidities. They are disproportionately affected in some of the European countries also. But again, in a lot of the, like Italy, many the population is overall older, so they were affected more.
Great. So that seems like there is a parallel finding between the European countries and in the North American countries. That's
Yes.
very good to know that. Okay, thank you very much for that. Now the next question that is, how are coronaviruses transmitted between people?
So it is spread primarily by the respiratory route, by close contact. So that's why we talk about the droplet transmission, which is usually, we say, about 6 feet. If you are in the vicinity of another person who is either shedding the virus asymptomatically, because you don't know, and they don't know they have the infection, and they are shedding it through the respiratory route by sneezing or coughing, or by maybe touching, but it's mostly from close contact, being within 6 feet of somebody who's infected or ill with the virus. So it's a lot of transmission within families happens, or it can happen in the healthcare setting, or it can happen in other setting where people are in close proximity to each other, and that's why the general advice is about the social distancing, to staying away from people who may be ill and you may not know, or they may not even know that they are infected already. So that's the reason for advising social distancing and covering your coughs and sneezes, what we call cough and, if you will, sneeze etiquette, that you cover your cough and sneeze. And that's the reason for putting the surgical mask on people, to control the source, so you may not infect others. You may protect yourself also from others who may be ill, but primarily it will keep you from coughing or sneezing on somebody else, and um, transmitting your virus without knowing. The other is, of course, hand hygiene. So simply, either you can use some form of other alcohol hand rub or other antiseptics, or simply wash with soap and water for 20 seconds. That's all you need to do and avoid touching your mouth, nose, and eyes after you have been in touch with somebody else or their environment. So those are the basic ways to prevent transmission.
Great, thank you. And if I recall, you mentioned roughly maybe 10 to 20% individuals who might carry the virus without any kind of symptoms. I mean, for a family, if we can assume that maybe one individual family member might have the viruses without knowing it, what would be your recommendation or suggestion as a family, now that we know somebody might be carrying the virus without knowledge? How, as a family, we should protect ourselves?
Right. That is, so the general advice is what we call quarantine, meaning, or isolation. So if somebody is already known to be infected, or already has the illness and is sick from the illness, they should be kept in a separate area of the house, if it is possible. If they have multiple rooms in the house, they should stay in their environment and not interact with others, and stay away from others at least 6 feet. That is the general advice. But the problem is, once they find out that they are infected, uh, they may have.
So yeah, definitely this is a challenge, and I believe that's why the infection rate is going pretty significantly high every day, every day. Do you suggest that I mean, if somebody just suspect they might have contacted somebody who might be infected, gone to the grocery stores or any place where might have infection happened, in the news we find out, should they go ahead and test themselves immediately? What would be the recommendation?
Yeah, so if you don't know, you don't know, and that's why you have to just follow those social distancing, wearing a mask, avoiding people who may be sick, or avoiding crowded places. Um, so if you get exposed to somebody who has tested positive or is known to have the infection, uh, generally what you would want to do, and again, it may not be practical sometimes, is to do what we call self-quarantine, meaning you've been exposed to somebody who was known to be infected. You need to be by yourself for the incubation period, which is where what we call the incubation period is when you get exposed to a infection with a virus, and now you haven't developed symptoms. It may take you about 14 days. If you were to come down with it, it will be about 14 days. Usually it will be about 6 days or so. So you should what we call self-quarantine. Should you get tested, now if you do the test too early, you may not find it. If you do it after you've become ill, you will probably find it. So if you waited when you develop symptoms, then you will find it. But the quarantine is, you got exposed, you don't want to transmit now, become a second source now to the others. If you were to expose others while the virus was incubating in you, and you haven't become ill yet. So that is not easy to do. I mean, that's what we advise people to do. And when it happens, somebody gets exposed to another person, we tell them to self-isolate or quarantine.
Yep, thank you. And the 2 weeks period, incubation, is this true fact, or also assumptions that, why we are sticking with 2 weeks? It need be more than 2 weeks?
It's uncommon. Generally, 2 weeks is fairly long, and that's it has been described as being transmitted up to 28 days. But generally, 2 weeks is the longest period we see for for the virus to show as an infection. So for the person to get exposed and develop illness, 2 weeks is the longest time. On an average, it's about 6 days or so. It can be as short as 2 days. So you may get exposed today and be sick by Monday. So the shortest is 2 days and the longest is 2 weeks. Can it be longer? It has been described as long as 28 days, but that's not common at all.
Okay, great. All right, thank you very much. And then that leads to the next question. If somebody gets the infection, how dangerous is coronavirus?
So again, that, like I said, some people may not develop any significant symptoms or illness to seek medical attention. They may have mild illness and they may not have any symptoms at all and not even know that they have the infection. But the ones who are sick enough uh, to seek medical attention and go to the hospital, uh, those people may require hospitalization. And then there are treatments according to what they're having. So if they're having difficulty breathing, they may need supplemental oxygen therapy. If they are still having difficulty and develop what we call respiratory failure, they may have to be intubated and be put on mechanical ventilation to help them breathe. They may also require some other techniques to help them ventilate their lungs properly, what we call proning, which is putting them on their belly to help them breathe better, to uh, uh, oxygenate them and ventilate them properly. And then there are some treatments that are used. Those are investigational, of course. Uh, One of them is an antiviral called Remdesivir, which uh, is not FDA approved, but it's received emergency authorization from FDA to be used as an investigational drug, usually given for 5 to 10 days. Then there are some other medications which are also used, like immunomodulators, which curtail your immune response to the virus. Also, we use what we call convalescent plasma, meaning people who were ill from the virus have now developed antibodies. We use their plasma and inject it into the person who's now ill. hoping that they have neutralizing antibodies against the virus and help them. Hopefully, again, these are all investigational modalities.
All right. Thank you very much for that. And next question is, what is the mortality rate of this virus compared to influenza?
Right, that's an important question. So this is, uh, like I said, some people may be very mildly ill, and we can say it's the same thing about influenza. But the mortality from a bad influenza, so in a bad influenza season, about 0.1% people die, meaning if 1,000 people get infected, only one will die, compared to 1.3% with this virus. Meaning if about 1,000 people get infected, 13 of them will die. And again, we don't know the exact numbers because we don't have the denominator. We don't know how many people are actually infected. So we don't know the exact numbers, and these numbers may change. But the numbers I've seen for now is about 1.3%, which is a significant number. And that's why you can see in the US, we don't know how many people are infected because we haven't tested everybody. And that will hopefully come with what we call serology. Once the antibody test becomes widespread and is available, we'll find out. But we know how many people have died so far. That we know is about 109,000 in the US alone. So
Yeah, that definitely, should catch our attention, because the death rate is a little bit higher than common influenza.
much more.
Yep,
Much higher than influenza, of course.
yep. Thank you very much for that. And then we have a few more questions left. Where do these new viruses come from?
So many of these viruses, especially these coronaviruses that are present in birds and animals, um, what we call zoonotic infections. So many of these new viruses come from animal sources. So the origin of this virus is thought to be from a bat, similar to the virus that was seen in 2003, also came from bats and was then spread to some of the mammals and then to the humans. So this virus also is similar to that virus, not the same as SARS-1, which was first seen in 2003 and has not been seen since 2004, came from bats. And this one also is thought to be originating from bats. And bats are very unique animals. They live in close quarters on top of each other in large colonies, and they can fly. And they cause many of these infections. Some of these new viruses we see come from bats.
Interesting, because what we hear that this is a new virus. However, bats are out there for millions of years,
Right.
but we don't know. So I mean, why suddenly now, not before? Or if it was before, humanity didn't have any knowledge. What would be your opinion?
Yeah, how did they jump species? That's what happens with whenever you have a virus that your body has no experience with. So this is a virus that we have other coronaviruses, but this is a new coronavirus that all of a sudden jumped species from bats to humans, probably through an intermediary. We don't know all the information at this time. Probably through an intermediary, some other mammal maybe. Uh, uh, and then when it comes to humans who have no immunity to it, you can see the severe illness. And sort of similar thing happens when you have a new influenza virus, and that's what I alluded to earlier with the pandemics from influenza in 2000, in 1918, 1958, 1957 and 68 was a new influenza virus that caused severe illness in human beings.
Yep, that's interesting to know. Thank you very much for that. More questions. Does coronavirus survive in the environment? Season change, some people might think,
Yeah,
it goes away. What about coronavirus?
Right. So the primary transmission is with close contact with another infected human being. And But can it survive in the immediate environment of the person who's infected? Yes, it can for a short period of time, but that is not the the easiest way of transmission. So it does not survive for long periods of time in the environment. So picking up grocery from the grocery store is not a mode of transmission, or receiving packages in or mail is not a mode of transmission. It's through the contact with another human being, uh, and their respiratory secretions is the, the, the likeliest way of transmission with this virus.
Thank you, thank you. And the last question we have, we know there are many pharmaceutical companies are working to create remedies, and we hear interesting stories. Our President Donald Trump also taking some remedies of his own choice, and some individual also suggesting to take natural vitamins or other remedies. How the scientific world, physicians are suggesting, what are the treatments or remedies to overcome this virus?
So the medication that we are using, so because we uh, are being used as part of investigation, so what we call investigational medications. Uh, um, whatever medications we're using at this time are either compassionate use in some groups, like kids or pregnant women. We use one medication I can mention is remdesivir, which is being used by many hospitals and healthcare systems. And again, it is compassionate use in kids and pregnant women. It is also used as an investigational drug, that remdesivir, which is an antiviral. Then there are some other medication which I mentioned earlier, which are used as part of investigation under emergency authorization by FDA. So yeah, again, there are some medications people were using because of what we call in vitro data, meaning they worked in the lab, but what works in the lab or kills a virus in the lab does not necessarily translate to what happens in the human body. So one of the medications that people were using earlier on is called hydroxychloroquine, which is a common antimalarial medication also used in some autoimmune diseases. That medication uh, there was some information from a study in France, and that's what it was based on. And then again, anecdotes and people telling stories about this medication works. Uh, but again, we have found out that it really may not be helpful. It may cause some negative cardiac events. So that medication is not being used.
Yeah, thank you very much. And we know for AIDS, for to get a working drug, the remedies, it took many, many years. And there are also copyright that poor countries in Africa and other places not getting the treatment. So, do you anticipate anything for COVID-19? If pharmaceutical companies come up with a remedy, do you think it would be available for all population of the world? Do you think any kind of politics, financial is struggling to get remedies in future?
Yeah, again, so prediction is hard to make, especially about the future. So yeah, many companies are working on vaccines, and the general feeling is that there will be antivirals, hopefully, and other medications, and hopefully effective vaccines that will have in near future. Again, I don't have a crystal ball. Uh, it's kind of cloudy crystal ball right now.
Right,
So
right, right. Yeah. Yep. So, yeah, thank you very much. I mean, I know sometimes, we do not have any information about the future and the financial conditions, and also the, how liberal these pharmaceutical companies would be to, cure the entire populations. So we'll see. But as far as our information goes, I think that was the last question we had. And I think that was very helpful for general audience to understand from the inception, definition to the symptoms to the remedies to know the comprehensive understanding of this new disease and this new virus. And we wish you success, and please stay safe as you are the frontline, doctors who are working with treating patients. So, God bless you, God bless your family, and God bless us so that we can come up with a remedy pretty soon. And thank you again, Dr. Saqib Hasan,
Thank you.
Infectious Disease Specialist.
Thank
Thank
you
you.
very much.
Thank you.
Thank you
Have
for
a good
having me.